I'm Sue, I'm one of the diabetes midwives, and I'm here to give you a simple explanation about gestational diabetes, what causes it and what it means for your pregnancy. So gestational diabetes usually develops in your pregnancy and almost always goes away after your baby is born. Hormones that your body produces in pregnancy stop your insulin from working as it normally does, so it doesn't work as well. And what this means is your blood sugar will rise, and usually the job of insulin is to come along, move that sugar from your bloodstream into your cells where it's needed and used for energy. However, these hormones that you have got in pregnancy are stopping it from working as well. But the really good news is that you have a really good chance of having a lovely normal pregnancy and healthy baby if you follow our recommended advice. So if left untreated, gestational diabetes can cause problems, for example with the growth of your baby. Sometimes there's extra fluid around baby that can cause your baby to be born early. And another thing that it's sometimes linked with is a condition called preeclampsia, which can result in high blood pressure. So these problems can sometimes mean that we recommend your labour is induced early, or sometimes even a cesarean section. But again, I just wanted to say how really important it is that if you manage your diabetes well, these problems can be greatly reduced and you would go on to have a lovely normal pregnancy and healthy baby. So what can you do and how can we help? First thing I wanted to say to you is that we are going to be working alongside you and we'll be with you to support you through your journey with diabetes. Now that you have the diagnosis of gestational diabetes, we in the diabetes team will be working in partnership with yourself, your community midwife, and sometimes the doctors in the hospital. Coming up on the screen, we've got a list of 5 important things that we wanted to talk to you about. The first one being antenatal care. As you know, antenatal care is really important, and even more so now that you have the gestational diabetes. We know that if you pick up a problem early, it's always much easier to sort. The next thing that you can do to really help is to work on your diet and activity levels. The dietitians have made a lovely video which we would recommend that you watch next, and they will go into a lot of detail about what you can do to help with this. And usually it's often something that you can just manage your diabetes with just diet alone. For some women, diet is not enough to manage their diabetes and they will need treatment. This is not your fault. It's about the placenta throwing out hormones that cause the insulin resistance we spoke about earlier. You might need metformin, which is a tablet, or insulin, or a combination of both to manage your diabetes if you're on treatment. Again, as before, we will be in touch regularly and work with you to keep this under control. The next thing, so along with your antenatal care, looking at your diet and activity, the next thing that would be really good is to monitor your blood sugars. Now, we've already said that often you can manage your diabetes just with diet, but so that we know that this diet is working as a treatment, we need to look at your blood sugar readings. And we teach you to set up with the blood sugar monitor, we ask you to send your readings in, we review them each week, and we talk to you either by email or telephone or both. And then again, by looking at these, often this is all that's needed. So antenatal care, we're going to work with you and your community midwife, again for the doctors. We're going to work with you doing diet and activity, get you monitoring your blood sugars. The next thing that we're going to arrange for you is an ultrasound scan. Usually this is around 36 weeks, but for some ladies they will need more scans, and this will be arranged on a case-by-case basis. So the last thing I wanted to talk to you about was collecting colostrum. Colostrum is made by your breasts during pregnancy and is there ready to feed your baby until around day 3 when your milk comes in. For women who have developed gestational diabetes, we suggest that it's a really good thing to do from about 36 weeks into your pregnancy. And the reason for this is because we know that ladies with gestational diabetes, their babies will be more prone to dropping their blood sugars. So if we would always encourage your baby to feed directly from the breast, but if for any reason your baby isn't able to feed, having this colostrum ready is really, really good to help with maintaining babies' blood sugars. It gives them loads of antibodies, and it just really helps to relieve the pressure and just make it much, much simpler. We have got a trust film that goes into a lot of detail about collecting it and gives you more information that we will put a link on the bottom of the screen for you to watch. Now my colleague Wendy will be talking to you about labour, birth and what happens after your baby is born. Thank you for watching. Bye.